We are looking for a lot of countries. We are really want them to open their doors to accept more and more cases because those patients are dying inside Gaza. The medical evacuation process, actually, it is very complex and it is changing according to the stages in Gaza. So if we can divide the phases into four, before the original closure of Rafah border by the 7th of May, which was directly from Gaza to Egypt, and from Egypt to the third country. And then during the closure of Rafah border, it was happening through Karm Shalom, directly from Gaza to Israel, and from Israel with two options, either to EU countries or to Jordan, and then transiting to other countries. And then during the ceasefire, those stages changed again and went to Rafah border. And after the collapse of ceasefire, it went again to go through Karm Shalom with a very limited options. Severely injured cases, plus all the chronic cases, which is cancer, plus other congenital disease and cardiovascular, they are in the main need of medical evacuation from Gaza. You don't know what is the reason behind of denying a lot of cases. Sometimes when they even approve the case, they refuse the companion. So here you are talking about like separation of family and impacting those people to need. That's also impacted many countries that they were very active or they were so motivated to take cases out of Gaza, but they were blocked by this refusal. And then many countries that they give up trying again and to take cases from Gaza. We are talking about the overwhelming health system, prioritizing the case, which one really need to go out and according to which condition, which also limited to the criteria, medical criteria and administrative criteria of the country. The limited options and limited destination is one of the most difficult one. There is majority of the countries, they are not opening to take cases from inside Gaza, and there are only few countries that could take cases. They took it under a few conditions. With all the restrictions I mentioned, unfortunately, MSF only managed to evacuate 22 patients to different destinations, including United Arab Emirates, France, Canada, Qatar, and to Australia. Those patients, they took a long time of coordination. That started on the level of the countries accepting the medical files and then starting all the visa process, then coordinating with our colleagues from the WHO to get these patients out after getting the COGAT approval and let them leave. The list originally, it was hundreds of patients, and we were blocked by either no response from the countries that we are approaching. We were facing a lot of cases that be rejected by the COGAT to leave the country. In addition to the list of the patients that MSF facilitated to evacuate from Gaza, we worked directly with MSF project in Amman, which is the reconstructive surgery program. And we managed to refer 13 cases, 10 directly from Egypt and 3 directly from inside Gaza to our project in Amman to receive the health care regarding reconstructive surgery. We are calling the Israeli authorities to allow the patients to leave Gaza and to be more flexible in approval of the cases. We are asking all the countries to be side of Gaza people by allowing more and more cases to have access to their healthcare system and participating on the medical evacuation and saving of the life of people.